Okay, good morning. Today I'm going to present two cases, one by myself, one by Dr. Qianzhong Wang, on the treatment of severe depression and anxiety. Where are we going? Sorry, Mark, which one? Down one? Ah, there we go. So just to introduce quickly a few issues that are interesting that might come up for discussion with these cases. Where does the Shen locate? Is it the heart or is it the brain or some combination of both? Traditionally, the residence of the Shen was always considered, there we go, was always considered to be in the heart. But there are some early passages in the Neijing which actually indicate that they believed the consciousness to reside in the brain as well. But really it was only from the Ming dynasty onwards that hypothesis became more prevalent. So what does the research say so far? I've made sure I've put a research summary in there, Mark, to keep you happy. So the latest systematic reviews, there's actually quite a lot on depression, a little bit less on anxiety, suggests that acupuncture may well be effective for depression. However, the phrase we're all used to hearing, the evidence is inconclusive due to the poor quality of a lot of the trials. Now, depression and anxiety, they're very difficult things to study, for Western medicine or for alternative medicine, because there's such an enormous amount of complexity and variables involved, which has led a lot of authors to speculate that the non-specific or the contextual factors involved in treatment are going to be quite important. So that's the therapeutic relationship, the ritual of the care setting, provided the patient beyond the sort of nuts and bolts of what we're doing with our hands or the needles or anything like that. But as acupuncturists, we like to think that where we put the points matter. So I'm hoping that these two cases might be able to shed a bit of light on the somewhat controversial issue about point specificity. I'm very happy I pronounced that right. Try and say it 3 times in a row, it's very difficult. So the first patient, 65 years old, presented with severe depression and severe anxiety, especially in the morning. She woke up every day with a panic attack, a severe panic attack and anxiety that lasted throughout the morning, eventually dissipated into the afternoon, and faded into just a horrible spiral of depression, which lasts for the rest of the day until she fell asleep. She would wake up every morning, the same pattern. Her mental health issues started when she was age 19 with the traumatic death of her partner. And back in the day, she was put on the old school antidepressants, stuff like Valium and Librium. And 10 years after that, eventually she was prescribed lithium, which she was left on for the remainder of her adult life. And it was only an impromptu health check in 2017 that found out that she had developed stage 3 kidney damage from the long-term use of lithium, which is a known toxic substance. She was immediately taken off lithium and all her mental health symptoms returned with a vengeance, the same strength that they were when they started. She was institutionalized in a mental health ward for a 3-month period where she received electroconvulsive shock therapy. She was prescribed a variety of SSRIs and antipsychotics. None of the new treatments did anything to abate her symptoms. As well as the psychological issues, she had severe lateral hip pain, which was really impacting her sleep quality, very overheated type, palpitations, sweating, mild constipation, recurrent urinary tract infections, severe social anxiety, and she was a suicide risk. She expressed a strong desire to come off of her medications because, well, they hadn't been helping, and also they would be potentially harmful in regards to her kidney damage, and had also given her some side effects, really, of fatigue and sedation. So I'm a palpation guy, I'm hands-on, I like to poke and feel the channels in the abdomen and neck and spine, everything like that. So all of her body was very, very sensitive, very painful, but particularly the kidney and heart channels, the Shaoyin and the Shaoyang channels, the gallbladder and Sanjiao. On the abdomen, kidney 16 was painful, we'll talk a bit more about that later, and also a lot of the points on the spine, the back shu were sensitized, as well as the occiput, the back of the head, and the sacrum. Pulse was rapid, as you might expect, and fine. The tongue was purple and slightly swollen. So I don't know if I can play this little video here. Visually, before we even do anything else, we can see the puffiness, especially around sort of kidney 10 area here. And so we can see that there is a bit of fluid retention and this channel looks affected. And even if I'm just palpating, tender, isn't it? It's tender slightly. And kidney 10 has been one of our main treatment points for Heather, and even down, very tender when we go down. And interestingly, it's sort of puffy around kidney 10. So we get the idea. I think it's always nice to see these examples visually as well. So I diagnosed her with heart and kidney disharmony, a yin deficiency of the heart and kidneys, and some internal heat and stasis, all of which were severely affecting her Shen. In this case, I think the channels and the pulse and everything correlated a lot with her symptoms, which is, it's always nice when that happens, isn't it? Doesn't always happen like that. I thought she was particularly interesting from a biomedical point of view, given the fact that she had a TCM kidney pattern and actual kidney disease. To what extent those were linked, you know, we can speculate. It's interesting. But she definitely has this, you know, cortisol adrenal gland disharmony. There's something definitely off with her endocrine system and the nervous system regulation of everything. These anxiety in the morning, well, this is where our cortisol levels are highest generally. So clearly something with her cortisol regulation was way off. That was really being disturbed. So what did I do? So first of all, I massaged all the channels that I'm using and use acupressure for the points prior to needling. My main pair was kidney 10 and heart 3, a sort of cooling heart and kidney combination, as well as spleen 6, gallbladder 20 and bladder 32 for the sacrum and the occiput to try and stimulate the parasympathetic plexuses and, you know, just get her sedated, a real clear state of sympathetic dominance for this patient, as well as the heart and kidney shoe points. So what happened? Immediately after the first treatment, she described, like a cloud has lifted and my vision feels clearer. She was immediately 99% free of her symptoms for the rest of the day. It was quite a remarkable, instantaneous result, and we were both very happy about it initially and optimistic. But the next day, she woke up, morning anxiety, panic attacks, same severity as ever, and that continued for the rest of the week, and we were sort of back to square one. But nonetheless, a really encouraging start. I was relatively confident at this point if we continued, you know, we might be able to get some better results. However, how are we doing, Heather?
I'm doing much better, thank you.
Excellent, good. So we have this consistent result with you, don't we, that after treatments, you really do get a lift from your symptoms.
I do. I get a clarity and a calmness, and it's very apparently different from when I come in. It's very notable.
Yeah, that's fantastic. And the frustrating thing we have with Heather's case is, unfortunately, the mornings remain a really difficult period where, despite having these really good results, the morning you wake up and the anxiety comes back really strong.
It does.
And we so far haven't been able to address that. Frustrating. 2 times a week, 6 weeks, you know, we did a proper course of treatments for her. After that, I made the following adjustments. You know, I threw the kitchen sink at her, so to speak, in terms of trying to adjust and choose different points. Sanjiao 5, gallbladder 41, this idea of trying to clear heat via the Shaoyang, did nothing. Trigger points in the hips did nothing to help the hip pain. Kidney 3 and heart 7 actually made her temporarily worse, which is quite interesting. The late Dr. Wang Yuji famously popularized the applied channel theory style. Has actually got a hypothesis that these points are quite warming in nature. You know, it's where the source chi from the kidney yang and the sanjiao. It's got quite warming nature, so he would actually not use them in sort of yin deficiency cases. So I found that interesting. Kidney 6 and heart 5 had a little bit of a better effect. This was another one of his favorite combinations, and kidney 6 is actually quite a popular point for any kind of adrenal cortisol kidney patterns in Japanese acupuncture, for any of you who are students of that. One of Master Nagano's favourite points, I think, for cortisol disharmony. And then I started thinking along the lines of the Dumai. Okay, so maybe it's more of a regulatory issue with the nervous system and the brain, and maybe we can help that. Do 24, do 20. Didn't really do much. So at this point, I'm thinking we've just reached the limit of what we can do. She'd been seeing me for about 2 or 3 months at this stage, moving on to weekly treatments. In her opinion, it was the only thing I have tried which has helped in the last 2 years. So it clearly gave her some valuable care in this time, some valuable relief from her symptoms when nothing else could. However, really, I started to think I'm at the end of what I can do. Maybe we're at the end of what acupuncture can do in general, and she needs some other kind of therapy. But luckily, I had a final ace up my sleeve, which was do 16 Feng Fu. It presented as very painful and palpation one day, and I needled it directly. Elicited quite a strong De Qi sensation. And immediately after that, the patient experienced this real calming sensation on the table, like a cloud was lifting, I think she said. Immediately very sedated, but described it alongside feeling a clarity as well, so a clearness with a calming influence. 2 weeks later, she came and reported a huge increase in the severity of the morning anxiety symptoms, a really clear increase. We hadn't had anything like that before. She was actually quite anxious telling me that and was in tears because she partially didn't want to believe it. She didn't want to get her hopes up, and we remained calm at this stage, but this was a great result we've been hoping for. Same treatment again, 2 weeks later, same thing again, like 95% reported improvement in her symptoms, and that was 2 Do 16 treatments 4 months later. She continues to have monthly treatments. It's now been 7 months since she came to see me, so 4 months since I first needled Do 16, and now is finally receiving CBT therapy on the NHS. We have tracked her outcomes using the MyMop, which I'm sure a lot of you are familiar with. The MyMop is the green table here. This was where Do 16 was needled. So this was a 6 out of 6 severity when she first came in, and she's now down to a 1 7 months later. So long-term improvement, as well as that immediate effect. The other 2 scales here, this is the hospital and anxiety depression scale. So this is a disease-specific PROM. That's a patient-reported outcome measure. And we can see exactly the same results. So both of the different measures correlated with each other, which was interesting. And we use these outcome measures to send a letter to her GP and her psychiatrist to request they consider reducing her medication load to help protect her kidneys. So a nice little example of how collecting some basic outcomes data can really help communication with other healthcare professionals and things like that. So this was a great result. It was definitely frustrating. It was quite an emotional journey for myself as well, but wonderful. And I thought, well, Do 16, is it really, can the points really alone be that powerful? I wonder if this has happened to anyone else. And Dr. Chen Jun thinks so, and he presented a very interesting case, which I'll share with you now. This was a female, 37 years old. She was actually an acupuncturist herself, I believe, or some kind of practitioner. She experienced severe depression, not so much anxiety with this patient, but severe depression and fatigue. She couldn't leave the house for the last 3 months, I think, before Dr. Wong saw her. She had this terrible brain fog. She couldn't even read one line of a book without just getting confused and foggy and couldn't concentrate on anything. Again, she was a suicide risk. She tried a lot of different treatments in 2 years: acupuncture, Chinese herbal medicine, food supplements, CBT, more than most people would try. So instead of faffing around for 3 months like I did, Dr. Wang got straight to the point and needled Do 16 on the first treatment, and the patient reported the following. At the first session, I was feeling particularly heavy, like there was a grey cloud hanging over my heart. As Dr. Wong needled Do 16, I felt the energy rise almost immediately, and I began to laugh. The heavy cloud lifted. I felt the energy rise upwards to the top of my head around Do 20. It was quite an intense and also quite a relieving experience. Not a dissimilar kind of report from my patient, right? It was that same feeling of sort of lifting and clarity. And when Dr. Wong first presented this case to me, I was like, oh, hang on a minute, that sounds a little bit familiar. He also used some other acupuncture points after Do 16, mainly focusing on Do and Renmai, as well as Heart 7, a pretty sort of, you would say, typical TCM style treatment for acupuncture depression. And this patient was also MyMopped. Although we don't have the long-term follow-up data, we still have a nice 6-week course, and she received 9 treatments in 6 weeks. The first orange line represents her total MyMop score with the depression and fatigue, which didn't improve quite as much as her major symptom, which was depression, which improved from a 5 out of 6 to a 1 out of 6. over the 6 weeks. And again, another very interesting result, similar cases, and so I wanted to present them together as well. So what can we learn from these cases really is, the important thing going forward for the treatment of other patients. Well, DO16 clearly appeared to produce a specific physiological response in both these patients. That's based on the qualitative statements they gave regarding their treatments. And also it correlates with the quantitative outcome measures that we use to track their treatments. It's maybe more clear in my case, as I tried lots of different approaches before needling DO16. It's possible to argue that in the case of Dr. Wong, his experience level, his needling skill, a more beneficial therapeutic relationship between himself and the patient was an important factor, and she might not have received as good acupuncture treatments before. We don't have the data on what previous treatments she received, unfortunately. But they would certainly indicate that where you put the point matters, right? That there's quite unique physiological responses that are triggered by certain points compared to others. And, would DO16 alone do the same? That's an interesting one. If we just needled DO16 on both patients? We don't know, unfortunately, we can only speculate. Was the effect synergistic with the other points? Did it sort of help the therapeutic effect of the other points? Did it act as a catalyst, for example? It'd be great to hear your feedback on that as well. But certainly it suggests that treating the DUMI in the brain and the autonomic nervous system more directly might be a more effective approach for the treatment of psychological disorders than conventional body acupuncture alone. So why DO16? Well, it's a very important point classically. There's a divergent channel that actually enters the brain from DO16 and goes through and travels up to DO20, just like the second patient sort of reported that sensation. It was quite interesting. DO16 was indicated for the 100 diseases of the head, which gives it a pretty broad scope, but certainly to me implies psychological and neurological conditions. It was always indicated as a ghost point for the treatment of severe mania and epilepsy, so these kind of severe psychological issues. And it's just got a very close proximity to the brain, hasn't it? So it was about the closest way we can actually treat the brain without going through the skull itself. I looked it up. It's rarely used in the West. Partially, I think, for a safety concern. It's worth noting it is a potentially dangerous point to needle. In the major trial they did up north with depression in the UK, it was not amongst the most common points used at all. DO20 was very common, Yin Tang is very common, but not DO16. It's used far more commonly in the Chinese trials of acupuncture and depression than in the West. So we know that the DUMI and DUMI points were definitely indicated for treatments of psychological issues in the classics. That's a whole big subject, and there are other approaches as well, but this approach is well justified in the sort of classical theory. And really the modern research, if it's saying anything, it's saying that the neurological mechanisms are important in understanding how acupuncture works. They might not be the whole story. There might be a lot of correlation there rather than causation, but different brain areas being activated and neural signaling pathways are clearly an important part of the story of how acupuncture works, particularly in regards to the regulation of the autonomic nervous system, the hypothalamic pituitary adrenal axis. This is really what governs our stress response and our homeostasis, right? And clearly with my first patient, this was completely out of whack, this whole system. And that there are quite clear parallels here between, the harmonizing the yin and yang functions of the body and the autonomic nervous system regulating the sympathetic and the parasympathetic activity in the body. The fact that DO translates as the governor vessel has led a lot of contemporary authors to speculate that this governing might indicate, a similarity between the governing functions of the brain and the nervous system. So depression in modern medicine and anxiety is very neurocentric. Again, whether that's completely correct is very much up for debate, but that's certainly what they think at the moment. And the new hot topic is neuroplastic adaptation. Well, a recent study on carpal tunnel suggested that acupuncture may be able to improve disrupted neuroplastic adaptation in the brain. But really the HPA, the hypothalamic pituitary adrenal axis, this is commonly dysregulated in a lot of pathologies, but especially psychological disorders, depression, anxiety. So we've got quite a lot of clues for a potential working mechanism here as well for these results. So, to summarise, DO16, these two cases clearly appeared to produce a very real, clear, specific physiological response, which I personally don't believe can be purely explained by the contextual factors involved in treatment, by the therapeutic relation alone. I think there's something physiologically specific going on here, above and beyond the ritual of care. Treating Do16 and the Do mind may produce superior clinical results than body acupuncture alone. This is clearly stated in classical theory, this approach. It's consistent with a modern medical understanding of psychological disorders, and there is mechanistic research supporting it with the neurological hypothesis. Thank you very much. I look forward to your questions.
Great, thank you very much, Nick. Any questions, please?
Can you tell us something about how you needle Do16 in this case with Dr. Wong?
Yeah, very good question. So Dr. Wong actually needled the patient in a sitting position, something like this, and his depth of insertion is 3 centimetres. Yeah, I'm not necessarily advocating for that myself, but that's how he does it, and elicits quite a strong sensation with the needle. Myself, in the prone position, to a depth of about 1.5 centimetres.
I remember one of those standard TCM textbooks that came out of China in the 1950s had a picture of needling Do16 in the right direction and the wrong direction. So I can't remember which was the right direction or wrong direction, but the wrong direction, it was basically going straight into the base of the brain.
Yeah. That'll get a response.
With a long needle.
Yeah.
Any more questions, please, for Nick?
What happened to the hip pain?
Oh yeah, sorry, I forgot to mention. Hip pain completely disappeared after we started needling Do16 as well. Yeah.
In your treatment, so after you discovered Do16 works, did you add another points or it was?
I basically kept on with similar to the original protocol, but switching the kidney 10 and heart 3 with kidney 6 and heart 5, as well as still doing the back shoe points, but Do16 was added instead of gallbladder 20.
And do you needle that first or do you needle in a certain order?
Yeah, good question. I think I did various things, but it didn't seem to make a difference. Sometimes I needled it first, sometimes at the end of treatment. Yeah.
How long you stayed in needles? 20 minutes, 30 minutes?
25 minutes.
Does anyone here use Do16 on a regularish basis?
I do now.
And would anyone like to say what the circumstances are for using it?
Well, actually, you're taking me right back to my dissertation.
Oh, great.
This is practically what I did my dissertation on.
Do16 or depression?
Well, it was based primarily. My mother was suffering with anxiety, perimenopausal. So I was quite young when I started studying acupuncture at 18, and it was quite hard for all of us in the family. And I was reading some scientific papers about helping to promote, for her, I was thinking her bone marrow. So the bone grafts do 16, do 20, and several other points, very similar. She improved dramatically.
Yeah.
So I obviously haven't copied that for other patients, but I have used it quite a lot, because I do treat a lot of clients for perimenopausal symptoms, anxiety being quite rife, and it's helped them so much.
It's interesting, isn't it? And that just points to how we so need to communicate cases together, because if that was a treated case recorded, then that is 3, and that makes, that's potentially another case series. And because we see such a diversity of conditions, we might not ever see enough patients ourselves to make all these links, but actually by communicating with each other and linking up our cases, we can see, that sounds a lot like my case. I think that's a really important thing to maybe take away from this.
Great. Unless anyone's got a burning quick one, we're going to stop now for a 10-minute break, and there's tea over at the back there. Thanks very much again, Nick. Thank you.
Thank you, everyone.